A very good afternoon and welcome to our session on the topic What Next After ET. We are glad to have Dr. Avani among us today to help us understand the topic in detail and also give all the insights related to the topic. If you have any doubts or queries related to the related to the topic, you can ask all your questions in the comment box so that our doctor can see and answer them later when we are done with the session. So stay tuned till the last of the session as we'll be answering all the questions by the last. Also, now, doctor, you have the stage.
Yeah. Good afternoon, everyone. I'm Dr. Avani, Senior Consultant at Apollo Fertility, Kondapur, Hyderabad. Today, I wanted to just share a few points regarding the embryo transfer and what do you expect after embryo transfer and what all you should follow and do's and don'ts after embryo transfer. So now, first of all, coming to the fertility treatments or IVF treatments, as such is little stressful for the patients and the couple, both emotionally as well as physically. So first, I let me just tell you about the IVF. See, when it comes to the fertility, the conception or the pregnancy or the meeting of the egg and sperm, which happens in the fallopian tube, this mixing of sperm and egg is done outside in the lab, in the IVF lab, and the embryo, which is formed after egg and sperm meet, is placed into the uterine cavity. So, this is called as the embryo transfer. It is the most important and final step in an IVF procedure. And the final step, and it all depends the success of the IVF cycle depends on the quality of the embryos, the procedure of embryo transfer, the uterine lining of the patient. All these factors play an important role in our success of the IVF cycle or the embryo implantation. Now, this what are the types? We have a fresh embryo transfer and a frozen embryo transfer. So what do you mean by fresh embryo transfer? The fresh embryo transfer means where in the cycle where we have taken out the eggs and formed the embryos, in the same menstrual cycle we transfer the embryos. That is called as a fresh embryo transfer. And frozen embryo transfer means the embryos which are formed in the IVF cycle after the stimulation and oocyte retrieval, they are cryopreserved, and later in the next cycle, whenever the conditions of the uterus lining is ideal, the hormones are fine, then these embryos are taken out, thawed, and placed into the uterus. This is called a frozen embryo transfer. So let me go through the brief procedure how you do the embryo transfer. So uh, for us, there are certain prerequisites for the embryo transfer. That is the like if we are going for a frozen embryo transfer, the woman is called on the second or the third day. Then an ultrasound is done, which is transvaginal ultrasound, and after that we make sure that everything is fine in the ultrasound. There is no pathology involved like ovarian cysts or any other pathology. And if everything is fine, we plan the cycle. So now, when coming to the embryo transfer cycle, it can be a hormone replacement therapy (HRT) cycle, or a natural cycle, or a modified natural cycle. So after we and again the patient is called back on the ninth or the 10th day, and we monitor the uterine lining, which is called the endometrium, and the thickness, which is called as the endometrial thickness. So we monitor the uterus layer till it is more than 8 mm. So And afterwards, we plan the transfer and we inform the lab to thaw the embryos. So, embryo transfer procedure does not require anesthesia. It is a simple procedure where the embryos are placed into the uterus cavity, and uh, it does not, the procedure of embryo transfer does not require an inpatient procedure or under anesthesia. So it's just a few hours procedure where the patient comes and the procedure is done, and within 1 hour they can leave home. So now the embryo transfer is done successfully. What should the woman do to enhance the chances of pregnancy? So, first and foremost, coming to the diet. So, diet is plays an important role in our success, where the diet involves taking of lots and lots of greens, that is leafy vegetables, and lots and lots of fruits and food with high fiber, complex carbohydrates and proteins. And in the diet, what to avoid? uh, to avoid high calorie diet, high sugars, processed food, aerated drinks, too much of caffeine, and too much of oil, and also avoid and stop smoking and alcohol, which all can cause us not to succeed. And the woman has to take all the vitamins, calcium and supplements which are given. Now this is the diet, and most importantly, we should be, I mean, the woman should be hydrated. That is, at least minimum of 2 to 3 liters of oral liquids should be taken every day, which is very vital for our success. So the next question we are frequently asked is about the activity, exercise, what all can be done, all these things. And see, there is no such literature or studies which say that with complete bed rest there is increased chances of implantation of the embryo. But yes, there shouldn't be a strenuous activity, and the woman can return to day to day life, keeping in mind that you shouldn't do strenuous activity. Just relax and take it easy for some time, and have enough rest and relaxation, and give yourself a break, so that this 2 week period you are not exhausted, or too much of strain is there on you. Then you have to look after yourself in this 2 weeks. Now, another question which we frequently get is about the intercourse. So, intercourse has to be avoided, as intercourse causes uterine contractions and lead to our unsuccessful implantation. So, intercourse has to be avoided. And and one more thing which is very important is reduce the stress. As such, as I have mentioned before, the IVF procedure, going through IVF procedure itself is emotionally and physically taxing and stressful. So you need to find ways to reduce the excessive stress you're going through, because taking stress would be negative for our success. So you can follow yoga or meditation, or read good books, or listen to music, whatever makes you uh, stress free. and be away from negative thoughts, and don't think what's going to happen, what will happen. So just be stress free, relax, and at least have 6 to 8 hours of proper sleep, and try to be as happy as possible. Then, coming to next, after the embryo transfer procedure, you would be prescribed certain medications, and please, you have to understand and that how they have to be taken, what times to be taken. Just keep an alarm or reminder in your phone or anywhere else, or that those medications have to be taken properly on time. If you're not able to administer certain kind of medications like vaginal gels, for suppose progesterone gels, please contact the doctor or the nurse so that to tell you what how they have to be used. So, and all the luteal, all the 2 weeks which the support has been to be given has to be taken properly, and you cannot stop any medication before talking to your doctor. And folic acid anyways would be given, prenatal vitamins, folic acid, and any kind of pain or thing, the medicine which we suggest is plain paracetamol. And if any medication you have been on before transfer or any other medication you require, you need to consult your doctor or the doctor who is treating you for the particular condition, then only take. But we would recommend plain paracetamol for any kind of pain. So, one more frequent question which we get in our daily practice is, can the embryos fall off from the uterus after they are placed? No. Once the embryos are placed into the uterine cavity, the embryos can't fall off from the uterus. Either they implant and on become an ongoing pregnancy, or they get absorbed and you it will come out as your regular cyclical bleeding. And one more thing is, what is the sleeping position which I should follow? So, coming to the sleeping position, there is no such position that you have to be like this only, in this position only for increasing the success, or implantation has will improve. You can be sleep in any position, just that keep it in mind that you have to be comfortable. In these 2 weeks, you have to relax and be comfortable so that we can anticipate a good result. So now coming to the symptoms. So when we say symptoms, um, uh, one more thing is that generally the beta HCG or the pregnancy hormone tends to start whether if it's implant from the ninth day of this of the embryo transfer itself. So certain symptoms are there which may suggest that we are successful, but it is not certain, like slight spotting, sore breasts, or increase in the abdominal cramps, or they can be a little increase in urination, frequency of urination. So the only these are all symptoms only in 10% can prove that it has led to successful implantation, but all these symptoms can also be present as you're taking hormones of estrogen and progesterone for the support. These symptoms can also be present when you're taking progesterones, and you can feel the sore breast, bloating, or slight spotting can be there. We cannot predict the success of our embryo transfer. The only way to determine the success of our embryo transfer is by doing a pregnancy test, or the HCG levels in the blood. So So first, and there can be tiredness also after pregnancy, after implantation, and this can continue till your delivery. But all these symptoms cannot be taken as, they're not definitive symptoms that definitely we are successful. Though in 10% we have seen that it can be a successful implantation. And the as I said, the only confirmative test is the uh, beta hcg levels in the blood, where it confirms, depends on the value, that it is positive or negative. So what happens after the embryo transfer is that the embryos can be transferred on day 3 or day 4 or day 5. So in the lab, generally the embryos grow till the day 5 blastocyst, where it has a better chance of implantation. And the blast is placed, and after 5 days the implantation completes after the embryo transfer, and on the ninth day we get to know the beta hcg starts increasing. Now coming to what should we do. So all these precautions needs to be taken. Just you need support and care, try to relax and have a proper diet, exercise, avoid strenuous exercise, and have good sleep, and take all medications on time, and let and hope for the best to happen. And the result also depends on how is your mental state, like is it in excessive stress or not. And also just be positive and think positive so that we get a good result. Thank you. And we will just wait for the questions.